Hi viewers, welcome to YohYoh Media Square. Today we are having a special guest, Dr.Meghna Varma, and she did her medicine MD from Mumbai, MD Ophthalmology, and she did her executive MBA program from ISB, and then recently she did a postgrad diploma program in Psychiatry from CMC Vellore, and she has loads of experience of 14 years in ophthalmology and medicine in various hospitals in Hyderabad, like LV Prasad, Pace Hospitals, Refractive. She is one of the directors in the Pace Hospitals. Welcoming Dr. Meghna. Hi Meghna.
Thank you. Thanks for inviting me here, Surendra. And I would love to share my experience as a doctor and as administrator of hospitals with you. I'm also an NABH assessor and would like to share the best practices of healthcare management with all of you. So thank you for having me here.
So guys, today we'll ask a lot of questions about our ophthalmology general issues, psychiatry, healthcare management. We get a lot of answers from Meghna, as she has done varied programs and very hard worker. I know her personally. Been working for a long time here in Hyderabad, so she is here now today. So Meghna, tell me, what are the major issues in the kids? Especially, I can see a lot of kids, they are having this myopia, they are wearing glasses. Is it a lifestyle issue or else a foods issue? Why they are getting it?
Surendra, till recently, even ophthalmology, the science did not believe that it is induced by environment, but more and more research nowadays is showing that myopia is environmentally induced. For example, if you see in China and Singapore, almost 90 to 95% kids in Singapore have glasses. Comparatively in India, it's much lesser. But it is thought because in Singapore you have very little open spaces, and the kids are inside their houses all the time. And because of this, because since their childhood they are not used to seeing long distances, they are always within the four walls of the house, and they are not used to seeing long distances. They're always reading their books and they are always not really exercising a lot. Myopia can be induced. Also, a recent research shows that if you make your child play outside in the sunlight for 45 minutes every day, it can significantly reverse the myopia, or it can at least decrease the progression of myopia. So I think science is going back to the old age saying of what our parents or our grandparents used to say, that too much of reading and too less of playing gives you glasses. So science is proving that recently.
So what are the basic symptoms in kids we can think about whether they have the myopia, and how often they have to go to the eye checkup clinics?
So the best age to detect myopia in a kid would be around 3 years, because that is the time that they can identify the letters, or they can read the chart which is given by a general ophthalmologist to them. Though the earlier the better. I would not even say 3 years. A general checkup within 1 year of birth is also advisable. So the earlier the better is the dictum. But definitely once the child starts going to school, when the child enters PP1, that would be a good time to go to an ophthalmologist and get the child's eye check done. Most of the children who come to me usually come at the age of 5 years or 6 years, when they have gone to their first grade, and either the teacher has said that the child is not able to see when they are sitting in the back benches, or nowadays most of the schools have these school screening programs. So when the school screening happens, when a doctor comes to the school and does a screening, they detect that the child has some problem, and then they refer to an ophthalmologist. So most of the kids who come to me are actually discovered by accident. Sometimes it happens that the child comes to us by the time that they are almost 9 years or 10 years, and by that time it is actually a little too late, because by that time the child's the neurological loop between the brain and the eye has already developed. So the best age, I would say, is around 3 to 4 years, that every parent should get their child's eye checked once between that age. If at that age the child's eyesight is detected and the child needs glasses, the child till the age of 7 years, it can be the child does not have the risk of developing lazy eye. After the age of 7 years, or maybe after the age of 10 years is the cutoff, I would say, when if the child has already developed lazy eye due to myopia, then the correction becomes very, very difficult. So the best age for a screening would be around 3 years, when the child enters PP1 or PP2.
Okay. So nowadays we can see a lot of YouTube videos people are following, and they think that exercises and reflexology works for them. Do you think so? These eye exercise helps in reducing the myopia, else eyesight?
So there are exercises which help in accommodation, or some people, their eyes cannot focus on one object in distance and in near accurately. That is called as accommodation. So exercises do help in accommodation, but in reducing myopia is something that allopathic science or ophthalmologic science does not really believe in. Though there are a lot of like parallel branches of medicine like Ayurveda, Unani and all that, they really believe that exercises can decrease myopia, but allopathy really does not. But I would say that no harm in trying. It will definitely not cause any harm. If at all it causes any benefit, there has been no scientific research around it, but you never know.
Any specific diet would you recommend this will help for the kids?
Yes. So again, I would say the age-old philosophy that a lot of green leafy vegetables and vitamin A is something which is required for our eyes, and vitamin A is available in anything which is yellow or orange in color. So you have your papaya, or you have carrots, mango. So any fruit which is yellow or orange in color is a good food as concerned when concerned with eyes, and all the green leafy vegetables. They should be a part of our normal diet to prevent night blindness and other diseases which can happen, eye diseases which can happen due to vitamin A deficiency.
Once it's been identified with the myopia, they will be suggested with the specs.
Yes.
What do you say, they should wear the specs all the day during the classes, at home, watching TV? Every time they should wear it, or else on and off they can keep it aside?
Actually no, because as I said, myopia, the right age for detection is 4 years. The latest age by which myopia usually leads to lazy eye. So what happens, if a child is used to seeing a distorted image from birth, at the age of 10 years, even if you give glasses to the child, the image correction will happen at the eye level, but it does not happen at the brain level. So the child is now, the neurological loop is now adjusted to seeing that distorted image and to seeing that low level image, myopic image. So even if you give a glasses to a 10 or 12-year-old child, sometimes they don't correct back. It is no use to give them glasses, and this condition is called as amblyopia or lazy eye. The only way to prevent lazy eye is that once glasses are given to a child, the child should wear the glasses all the time. If they don't wear the glasses, they wear it only for some time and keep it off again, as you were asking me, then the chance that the child develops lazy eye are very, very high. So once the child is prescribed glasses, they have to wear it throughout the day. The only time that they remove it is during sleep time.
Okay. So in the elders, we can hear the word of computer vision syndrome, who are working on computers. Above the 15 years, 20 years, we can see a lot of people are wearing specs. Can you say something about this computer vision syndrome?
So actually, I do get a lot of patients from IT industry. Their chief complaint is this blurring of vision sometimes during the end of the day, or dryness of eyes, irritation in the eyes, and things like that. So this is basically what happens is, especially in the IT industry, they are always indoors in an AC environment. Plus, they are looking at the screen all the time. So when you're looking at a laptop screen, your blink rate decreases. We tend to stare when we are looking at the screen. Any screen, TV screen or laptop screen, we blink less. So blinking is very important for distribution of your tear film on the eye. And because of a less blink rate, the tear film distribution does not happen properly. Plus, the evaporation of the tear film increases, which leads to dry eyes. So a dry eye is very, very common in people who are always on the laptop, especially in the IT industry. And to prevent that, obviously, they should have some kind of routine where they take their eyes off the screen every 1 hour, 1.5 hours. That they also adjust their eyes to looking at a distance, not keep on looking only at short distance computer screen. So when they take their eyes off the computer screen, they should look outside a window every 1 hour, 1.5 hours. Take some short breaks to let their eyes have a little more exercise than just seeing on the screen all the time. Also, not using AC, especially if you're in the AC environment throughout in the day in the office, at least you should not use AC in your home or something like that. Some kind of adjustments can be made. But yes, computer vision syndrome is very, very common in the IT industry. And if detected, if any IT professional has these kind of problems, they should not ignore it, but see their ophthalmologist and take care of it as soon as possible.
Do you think there is any relation between the eye vision, stress, anxiety, depression? There is a lot of words are going on with the software people and workaholic people, management people. What is meant by stress, anxiety, depression, and any connection to the vision?
So I would not really say a direct connection to the vision, but yes, again in the clinic setup, we do get a lot of patients who are having headache. The main reason for their headache is the stress, anxiety or depression that they are going through, and then they think that maybe the headache is because of the specs. Because it is not, our Indian culture is not very open culture where you accept that depression is a problem or anxiety. Like you cannot tell your boss, I am depressed, right? Your boss is not going to be kind to you. So the way it manifests it's called somatization, where your anxiety or depression comes up with somatic symptoms. One of the somatic symptoms, as I said before also, it could be headache, it could be that you feel there is some kind of irritation in your eyes or you're not able to see properly and things like that. So not a direct connection with the eyesight, but somatization could be one of the symptoms of why a lot of people suffering with anxiety and depression actually visit an ophthalmologist. And as an ophthalmologist, I think we should also not just write them off by saying ki, oh, you don't have any specs and you don't have any problem, but also try and address their bigger issues, their real issues, because they might not see any other doctor except you. So try, as ophthalmologists or as doctor communities, we should always look for the issues beyond the presenting complaints.
As we talking about the psychiatry issues, why they should seek a doctor's help rather searching in the Google for various anxiety, stress, depression things? Why they should come to you?
So basically nowadays it is so common. On one hand, so you get all kinds of people. On one hand, there are people who are actually suffering from depression and anxiety, but they are not ready to admit. They will not tell anybody around them that they are having some issues because they think it's a stigma and they should not be talking to their colleagues or bosses or husband or wife about it, right? On the other hand, the other end of the spectrum is there are people who don't have anything, but they spend a lot of time reading up on Google, and if you type just depression or anxiety on Google, you will get like some 7 lakh pages on it. right? So which of those 7 lakh pages is really right? Which of them is really your symptom? Because a lot of times psychiatry is a branch where it is not a, I would not, it's not like really definitive. It is a lot of it is personalized to your context, to your physiology, to your environment, to your family background, to your social status and things like that, which Google cannot map it properly. Only a psychiatrist can. Also, there are definitive criteria for anxiety and depression. So it's not just that I feel anxious today and I'm suffering for anxiety, or my spouse shouted at me today and I'm depressed. It's not that. It has a lot of criteria. It has to be, before labeling somebody and suffering with anxiety disorder or depression, there have to be a lot of criteria have to be met. And as I said, it has to be mapped to your context, to your personal settings and to your social settings, which only a psychiatrist can do and Google cannot.
Well, what is meant by insomnia? I can hear a lot of these words from the current working people. Can you talk about something on insomnia?
Yes. So again, a lot of patients that I see usually have, especially with the gadgets coming in, nowadays people have this habit of seeing their mobile phones or playing some computer games before they go off to sleep. They think it is their relaxation, or they would be, after they come home from office, after their dinner, they would be on Netflix seeing movie after movie, right? So with the gadgets and with so much technology coming in, I feel that the rate of insomnia has really increased, because not only, again, there is a correlation between the blue light which is emitted by the laptops and all that and the eye health. Also, it is related to insomnia. Both the factors, your eye health and your mental health, get affected because of screen time. And insomnia is something that a normal person, it is said, requires around 6 to 8 hours of sleep. Of course, it is individualized, but anything less than that can cause difficulty in your routine day-to-day functioning. And when it starts affecting your day-to-day functioning in terms of, during the daytime you feel low on energy or you feel sleepy during the daytime, but when you go to bed and you want to sleep, you cannot fall asleep. So that kind of thing is called as insomnia, and or sleeplessness. And more important than medications, a lot of people think that just by taking sleeping pills, that problem will be solved. But again, sleeping pills, they are just a short-term measure, and plus they have their own side effects and they have their own addiction problems. So sleeping pills are not a solution, and more important is the sleep hygiene. Sleep hygiene basically means things like not seeing your laptop or gadgets when you're going to sleep, having a good day-to-day routine, going to bed at the same time, getting up at the same time. Certain things that you do so that your sleep pattern does not get disturbed. And that is the more important factor that should be taken care of in insomnia, rather than just going to a psychiatrist and asking for sleeping pills.
Any easy methods to relieve the stress or anxiety or depression and insomnia? I think you would have practiced a lot of things. Generally, doctors say, try to come and consult us. We will give some sort of prescription or treatment. At the moment, can you suggest any simple methods, like before going bed, you are saying that don't use laptops or gadgets.
Yes.
Don't talk unnecessary things which disturbs your sleep. So do you have any other simple methods people can follow and reduce these issues?
Sure. So again, I believe at least psychiatry, as it's not like you have fever and you go to a doctor and the doctor writes paracetamol and your fever is fine. So it's not like that. It's a much bigger science, and medicines or pharmacotherapy is only, I would say, very little part of psychiatry. The more important part is psychotherapy, where you try and understand an individual and contextualize the treatment to that person's physiology, that person's psychology, that person's social background, family status, and other things, right? So more than trying to, of course medicine has its role, but more than the medicine part, it is very important to develop this support system around you. So let it be anxiety, let it be depression, let it be any psychiatric disorder, the most important thing would be supportive psychotherapy. And supportive psychotherapy is about knowing yourself well. Like what are the kind of, maybe you are suffering from some other physiological condition like hypothyroidism. Hypothyroidism itself predisposes you to certain psychological depression and other illnesses, right? So one is knowing yourself well, and the other part is this knowing your support system well. And support system can include your family, it can include your friends, it could include your workplace, it could include your religious beliefs. Some people find solace in God or in their religious cultural things that they do, right? So any psychological or psychiatric issues, what I would really suggest to every person is know your support system well and use your support system well when you are going through these issues.
Meghna, what are the common issues with the IT people? And tell me more about what is stress, anxiety, depression. There is a lot of weight going on my head and they're quite anxious, sleepless nights. Can you talk on that?
Yeah, so the kind of patients, especially from IT industry that I have seen, is they mostly come with a lot of anxiety. Maybe this is related to the kind of deadlines and the less of work-life balance that they perceive that they have in their life. But a lot of them also do a lot of Googling, like, they develop a minor symptom or something and then they look it up on Google and then they think that they have that particular disease. Then they look up the treatment of that disease and then they go to 3 or 4 doctors before somebody actually tells them that no, you don't have a cardiac problem, you have already been to 4 cardiologists, or you don't have a gastrointestinal problem, you have been to 4 gastroenterologists, you go to a psychiatrist. So anxiety is pretty much common in IT industry. Maybe it is driven by the chronic stress that they face all the time. And I would suggest that, it is not that everybody who is working in IT industry has anxiety, but there are some criteria for anxiety. And like if you always think of a negative outcome in any situation, if your mind directly goes to the negative most outcome, like if your child is crossing the road and you will think, oh my God, what if he has an accident? So that is like your mind jumps to the most negative outcome. That is one of the criteria to know whether you have anxiety or not. If you have chronic fear of something, like fear of height or fear of flights, to the extent that you start avoiding it completely, that is again maybe one of the other criterias. Some things that sometimes it might be associated with some somatic symptoms like trembling or not having direct eye contact with people when you're talking. So there could be associated other symptoms also. Anxiety, as I said, it is a complex, it has many different criteria that we need to check before really labeling somebody as suffering from anxiety disorder. And my request to the IT industry, to the IT crowd would be, please don't self-diagnose. Please don't look up these symptoms on Google and self-diagnose, because it actually leads to more anxiety. So if you might be suffering from mild or moderate anxiety, just looking it up and trying to self-diagnose and self-treat makes it into moderate to severe anxiety. So it would be best to come to a psychologist or a psychiatrist and talk about these issues.
So for any psychiatry issues, mental issues you're facing, while you're working or else at home, please do consult a specialist like Meghna, psychiatrist, who are available in your city, and just get some suggestions and follow the treatment. Don't treat yourself. It will make you unnecessary issues. So anything else, Meghna, you can talk more on this?
Yes, the other thing that I have seen very commonly in IT industry is depression, because these are young boys and girls who have, fresh out of college, and they just come to a different city when they get a job. They go to a different city and they get into a job. They are not able to, there is a lot of pressure during training. There is a lot of politics around them in a new office place. They don't have friends around them. So suddenly they find themselves into a different environment, and beyond, till some point it might be adjustment issues, or it might become an adjustment disorder, but beyond certain point it can get into depression. And again, there are some criteria of depression, like you don't feel like doing things that you used to enjoy doing earlier. So that is one of the criteria, like you used to enjoy hanging around with friends or going to a movie earlier, but now you don't enjoy it anymore. Second criteria is lack of energy. You feel all the time you're feeling tired, or you feel like, you just not want to do anything. So there are different criteria for depression, and obviously low mood is another criteria, like the feeling of sadness all the time, the feeling of negativity, feeling of hopelessness. So these are all criteria for depression. So again, depression is very common amongst youngsters, and I am seeing more and more of it amongst youngsters nowadays. Again, the thing would be not to self-diagnose just because you had a fight with your friend and you're feeling sad, or you did not pass your exam, or you didn't get your appraisal well. You're feeling sad for a couple of days is not depression. Depression is something way more serious, and hence it should not be self-diagnosed. You should talk about these issues with a professional. Always seek professional help if you are feeling any of these symptoms I spoke about.
Okay. The same psychiatric counseling, would it be available in sports? There are a lot of kids that are trying for cricket practice, yes, shuttle badminton, athletics. They are much back when they fail. So can you talk something on the sports and psychiatry?
Absolutely. So in fact, very recently, more and more people are recognizing, or sports councils are recognizing, that it is important to have a psychiatrist, or I would say the coach come psychiatrist kind of a person on board of all the sports councils. In fact, one of my friends who did the same PG diploma program in mental health with me is now working as a psychiatrist with the Sports Council of Kerala, the state of Kerala, the Cricket Council. So more and more, I think more and more sports bodies should start to understand the need of and there are a lot of other issues among sports people. The pressure, the competition, the failure. Also surprisingly, like this friend says, there is a lot of issue about suicidal tendencies amongst sports people. So yes, there is definitely a need, and the more sooner the sports councils and bodies start recognizing it and having an institutional psychiatrist with them, the better it would be for sports people.
And about the drugs, narcotics, whatever the students are using now, the smoke, the different
Substance abuse, yes.
Yeah. So can you talk on that?
Yes. So there are a lot of factors which lead to substance dependence. Again, just having one or two smoke does not make you dependent on any substance, or having one or two social drinks. There are certain criteria before you start saying that you are dependent on a drug or a substance. Like, you cannot stay without that drug. You start having some kind of withdrawal symptoms, or you need an eye-opener drink. Like, the first thing in the morning, as soon as you get up, you start thinking about your next dose of that drug or the next dose of alcohol. so over a period of time you start getting cut off from your family and your social background, because you are so focused about getting your next dose of drug that you start becoming a social recluse. The amount of drug that you require to get your next kick keeps on increasing. So there are certain criteria, because of when these criteria are met, it's a danger symptom. Yes, and when these criteria happen, it is very important that the social structure, the teachers are more vigilant. The parents know that if your child is behaving a little oddly, if he was a happy-go-lucky child and he used to play, but nowadays he does not want to play, he's at home, he's not doing well in studies, suddenly failing in academics, there are small little thefts happening in your house, you feel that the money suddenly is disappearing. So the parents have to be vigilant around this. Nowadays, because of a combination of various factors, nowadays we have nuclear families, both parents are working, the mother is busy with her life, the father is busy with their life. They feel that just giving money to the kid and putting him into a good school, and that is like their duty is done. Kids have a lot of exposure through on the websites, like not only, I would say, not only the other thing that I have seen a lot of dependence on in the teenage crowd is on pornography. So a lot of them have access to porn on internet. So all these things are very common, and I would say the first step of controlling this drug menace is when the social structure becomes more involved in the child. The parents and the teachers are more involved with the child, and they pick up these danger signals, they pick up these red flags, because the sooner they pick up and the sooner the child enters into a rehab program, into a detox program. Rehab again has two parts. One is de-addiction part and the detox part. The de-addiction part is where you through medicines you can let the child come off the drugs. But the de-addiction part is the more important part, where the child has to be motivated to give it up. Because till the time the motivation does not come, nobody in the world can help the child. So that motivation part has to come from the family, it has to come from the teachers, from the friends, from the peer group. And the first step, as I said, lies with the parents and the teachers, that they pick up the red flags as soon as they happen, and then they visit a psychiatrist and a counselor to undergo the detox and the de-addiction program.
And about the children's psychology, most of the moms and parents, they are worried about their studies, knowledge, intelligence. Do you have any psychological or psychiatric tips for these kids to improve their learning, concentration, or focus on the studies or sports, whatever the activities they does? Do you have any suggestions?
Yes. So again, imagine a 6 or a 7-year-old child. Every time he is being told that concentrate on your studies, concentrate on your sports. Teacher is telling the child concentrate. He learns this word concentrate or focus, but nobody tells the child how to concentrate or focus. We ourselves as adults, half the time we are on the phone. Even on the phone, we change the website every 20 seconds or something, because we are bored with. We will switch over from one serial to another on Netflix. So as adults, we ourselves suffer from concentration deficits. And why blame a 7-year-old or 6-year-old child? So the first step if you want to teach your child to focus or concentrate, again, you have to lead by example. The first step lies with the parents. You have to spend that time with your child to teach him methods of concentration, methods of focus. You yourself have to keep yourself off from the gadgets so that you can spend that time with your child. There are techniques, there are meditation techniques, there are art therapy techniques. There are different techniques which can help the child concentrate better. But the first step is with the parent, lead by example, and not just by your words.
So I don't know, I'm not sure about the autism. Does it fall under the psychiatry issues?
Yes, definitely.
Can you talk something about autism? It's a major issue nowadays, it seems.
Yes. So autism is again a spectrum spectrum disorder. It's like autism is not just a couple of symptoms, but it is a spectrum of certain disorders. Again, the right age or the time, the earlier you pick up autism, the sooner it is picked up, the better. Usually the child will start manifesting the symptoms by the age of 2 or 3. Usually a triad of symptoms, like children have repetitive behavior, their emotional or social component is very low, they are not very social, they don't play with other kids like normal kids do, and language ability, like they cannot really express their emotions as well as other kids. So it is a triad of these 3 symptoms. Social engagement levels are low, language skills are a little less, and repetitive behavior happens. But again, it is a spectrum. Only one of these 3 might be present, or a little of all 3 might be present. So the best thing is, again, if you feel there is something wrong, you should meet a specialist. There are pediatric neurologists, or there are child psychiatrists and child psychologists who would be able to, they will give you a list of questionnaires. They will interview the parents and the child to find out really if autism is there or not. But if it is picked up early, there are a lot of techniques. There are speech therapy techniques. There are motor development techniques, gross motor skills and fine motor skills development techniques. So with all these, and plus counseling, so with all these techniques, there is definitely hope that the child will become much better than what the child will fare if left alone. So the earlier, as I said, 3 years the child, the time the child enters PP1 or starts going to school is the right time to keep your antenna high and to catch these signals if your child is displaying any of them.
So for all these issues, ophthalmic, psychiatry, Meghna will be sitting in Pace Hospitals and Refractor in High-Tech City, Hyderabad. You can see her there, and she'll give you a lot of tips. And she also expert in healthcare management. She did a lot of projects while doing her ISB and the hospital consulting. She can talk much about this NABH, auditing and healthcare management. Can you say something about healthcare management, how the young doctors has to learn this program, or while setting the hospital, what are the things they have to follow?
Yeah, so unfortunately during our MBBS we are only taught the science and we are not taught the management part of it. But once we become a doctor, management is definitely a part of your daily routine. Even if you are in a service, you are reporting to somebody, or you are part of the management system of the hospital. If you set up your own practice, then there are a lot of people who are reporting into you, and you have to take care of different facets of a hospital. And hopefully very soon healthcare management would become a part of our MBBS curriculum, so that the young doctors know about how to set up a practice, or how to be a part of a larger practice in a much more effective way. But certain tips that I would want to give is, while you are setting up a practice, there are certain aspects. One would be infrastructure. So when you are setting up your infrastructure, or you are part of another infrastructure, there are certain things which are non-negotiable, like the legal issues. So always make sure that your certificates are in place. The legal issues need not be only regarding your hospital setup, they could be regarding like pollution control board certification, or it could be regarding fire NOC and things like that. So all those things need to be looked into before you set up your practice, or you are working for somebody else. You should be aware of the legal issues involved in a medical practice, or the medical legal aspects of a practice. So that is, these are the two important things, the infrastructure and the medical legal aspect. The third aspect, which is very important and we often forget, is the HR. Like, we don't work in, as doctors, we don't work in silos. We have assistants, we have nurses, we have technicians, we have biomedical people, we have so many housekeeping, a receptionist, everybody, right? So a very important part of hospital management is human resource management, and this is some aspect that we are not taught during our MBBS. But yes, this is something that we should be more aware about and probably read up more about how to manage a good practice. The fourth thing that I would say, which is very important in the current world, is IT. So whichever setup, a small setup or a big setup you are a part of, you would definitely have a hospital management system, you would have an EMR, you would have digital marketing, social media presence, and things like that. So I think the fourth important part that is very important in your practice and you should know how to manage is the technology, the IT part. So very briefly, these are the 4 aspects that I would ask all the young doctors to update themselves on while they are learning their science.
Do you suggest any executive programs or short-term certificate course for this healthcare management?
There are a lot of courses. I mean, the MBA program, the 1-year MBA program I did from ISB was in general MBA. But there are a lot of healthcare MBA programs which help you. And hopefully, as I said, it should be made a part of the curriculum of the MBBS curriculum, because it is not separate from what a doctor is expected to perform in his actual practice life.
So, as Meghna suggested, in healthcare management, there are a lot of disciplines, short-term programs and executive programs at all the top institutes. You can try in any for the further questions, you can write down in the comment section. And as I said, she works in Pace Hospitals in Refractor. You can consult her. You can post your questions in the comments. Yeah. Thanks for watching, guys, and we'll get back with you with few more videos.
Thank you for having me here. So thank you. And for any more questions, I would be really happy to answer them if you can put them in the comment section. Thank you.